Welcome back to our YouTube channel. This is the NEWSTART series and we are on exercise, the last episode. And today we're going to be discussing osteoarthritis, and we hope you are blessed and stay tuned for everything that we have to say. So jumping off straight into the video, there is a misconception that osteoarthritis and osteoporosis is the same thing. It's not quite the same. What we mean is they both have the word osteo. The word osteo means bone, and this is where it differentiates. So arthritis literally means inflamed joint, and that is what we're going to be diving into today. To me, should I explain in a bit brief? But osteoporosis is osteo, which means bone, pore, which means intokrontokro or like holes, and then cis is just a process. And see, it is a process where the bone, the inside of the bones becomes brittle and it breaks down from the inside out. And see, what Timo said with the images, when you have time, images, you can see, to picture the pores, it looks like sapo, maybe to say sapo, like that one with the pores in there. So you have little holes in between, and it's not really functioning as a well put together bone. And see, when you stand, it is weak. You are weak when you have osteoporosis. But with osteoarthritis, your joints become inflamed, and then you have a lot of pain and a lot of swelling, and that is what we're going to be chatting about today. And see, as I said in the very, very first anatomy video of the exercise episode, we talked about supportive structures in the joints. And see, what we're looking at in this image is your knee. So essentially what we said was it has some things to put them together. It stands and it is straight and nothing goes wrong when you're standing or something like that. And when you can say we a bone and a way bone any share na a joint, and when they two meet on the tips of them we have something called cartilage. Na me ka say it is akokonam baby a grill no, and no be near come say me baby a grill no, it helps it rub off each other and it just slides off it. It's very easy until say pain be out. But with osteoarthritis, this is the wearing down of this part. Into baby a grill no, where I'm circling is where it wears off. Like wears off as in epipat sort of. And that is what we have. And see, when the hyaline cartilage, your friend cartilage, say epipephrine, then that means you've got the hard bone meeting each other and it's creating a lot of friction, a lot of pain, and that is why say or something like that. This is what we're talking about. And then we also said say synovial fluid. It lubricated the area and man moist. And over time this moist area becomes more moist because our body need try to compensate for a yaw na AC and a yaw is and it creating more swelling and more of those pain in that area and see, that is basically osteoarthritis in a summary. All right, so I had him saying, let me say we all have an appreciation for exactly what we're looking at. And see, osteoarthritis on our left is a healthy bone, and our cartilage is still intact, but on the right we can see that breakdown that's going on. Maybe a epipano, that is where we're looking at. And see, when it breaks down, it leads to stiffness, some pain, and some reduced mobility. And see, let's go and chat about the symptoms more clearly. The symptoms when you have osteoarthritis is joint pain over here, say and you have muscle weakness. Muscle weakness baby joints in the one weakness into yemfa say wabache ene you will feel the weakness up here as a won't mean you so on saha and as a forearm. If it's your knee or sre ebe weak, and I say one into ebe weak akra just because of the joint that is there. And then you have some stiffness as a inwaititi kakra. And then you also have swelling. Swelling nana make us say it caused by science you na as a what joint name why Jenny body is trying to compensate for the fact that two bones so right now there's a lot of pain into ebe increasing sooner, and then that is what increases the swelling. And then there's crepitus near crackling sound. I say emu bubu, like that sound. And then you also have decreased range of motion, and no yet flexibility into before now to me tone same say I won't mean tone same like that anymore, because first of all it's stiff ebe ttt, and then like won't me move it yeah. Anyways, that is all the summed up symptoms and signs of osteoarthritis. I wanted to have an appreciation for where it happens. This is all joints. You share your body anymore from on top of our head. We have the mandible. Mandible, yeah, ultimate reside. Osteoarthritis etimi ho, o kon, wabeti, o wabache, on semne, or wrist, and then you have your waist, and then your knee, and then your foot. It can literally happen every single place that there is a joint. Baby, bone, any bone, there is friction there. As I said, how it happens, you go through step by step everything that happens, but generally, it happens with aging. It naturally wears away when we grow from from 50 to 80 most people do experience this type of natural osteoarthritis. And then there's also mechanical stress. Mechanical stress, if you are obese, it creates a lot of pressure for your knees. As we said before, your body is made to compensate for one another. Our legs compensate for the weight up of our body. The more weight you have up your body, the more stress you put on the legs. Obesity can cause osteoarthritis, especially at the knee and the hip joints. And then we also have genetics. Osteoarthritis runs through the family. They don't necessarily age, they don't necessarily have any mechanical stress, but it's just because will be also when you be. And then there's also metabolic factors like things like diabetes, other illnesses that cause osteoarthritis. These are the general causes of osteoarthritis. And I also wanted to have an appreciation for the hip and the back bones. I say osteoarthritis way a healthy one. I'll put the healthy one in green so we can all see. So this is a healthy one. You can see the hip bone perfectly put inside, but then we can also see osteoarthritis. Now you see the wearing away over here, and it's not quite pleasant. It creates a lot of pain for a lot of people. And then you can also see in the spine, there are other bones that spring off the side. It wears away a little bit. They're called bone spurs. I say a perfect one. I say the extra bits of the bone now as a feely lumpy, and it's breaking down essentially. And you may ask yourself, if I have any of these signs and symptoms, what can I do? There's a lot of things you can do actually. First of all, you'd have to visit your GP and explain your signs and symptoms. And we're going to talk about the management soon, but in Australia, for you to see any specialist to do with let's say the physio, the exercise physio, the rheumatologist, the occupational therapist, you'd have to get a referral first. But we'll go through the management first, and then we'll see how we can go about helping you with osteoarthritis. Into your very first bottom line of defense, education, exercise, and weight control. The second is in pharmacological things and therapy. And then the last option, the last resort would be surgery. So going through one by one, our very first line of management or treatment, a non-pharmacological way, a drobianim. This starts off with patient education. So why now experiencing these signs and symptoms it's a very good thing that you get yourself asking questions to your GP or to someone that can lead you to a GP so that you can get your questions answered. If you're someone that is also like obi de na asema bedanwa, if you are a consultant of somebody else, then it is very advisable, say, you let the person know, say, they need to see a GP and get their questions answered. And then we have weight management. Weight management near say obey exercise, physical exercise to manage our the weight that we are gaining. As I said before, no, or upper body, no, if it gets bigger than your legs, you put a lot of mechanical stress. You put stress on the legs or the knees and everything. It's very good that we manage our weight in that manner. You can do all sorts of exercises like hiking, swimming, jumping jacks, skipping rope. There's a whole lot of things you can do. You can buy a treadmill and do some light jogging. You can decide to go on jogging outside as well. You can ride a bike with your kids. There's so many things that you can do to stay active. And then we have heat or cold therapy, which is heat pads na yutimi heat and I say hot water bottle just to put onto the joint wherever it hurts or wherever it is paining, and then that would bring some sort of relief. And see, the second line of management is pharmacological, which is yedruno. With this one, I don't want to step into the the pharmacological mechanisms of how edrone works, but usually your GP would prescribe you some kind of pain relief, and we see the Nurofen, ibuprofen, Advil, all those pain relievers, and say if it's it depends the severity of your osteoarthritis, but generally the doctor should be able to give you a dose and a suitable pain reliever to help you relieve the stress and the pain. And then the last resort is if your osteoarthritis is very, very severe, you'd have to do surgery and get whatever joint it is replaced. And the most common replacements that we've seen is the knee replacement, as you can see by the image. This is a healthy one, and this is one with the metal. And see, the knee one is very common, and then the hip one is also very common as well. But yeah, this is the last resort, and prevention is better than cure, and this is why we are promoting exercise. Please, 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 in your normal daily life, if you are a young person, if you're a middle-aged person, or if you're an old person listening to this, it is not too late to sever your exercise and to sever your energy. It is always beneficial to do your exercises. It might not be to prevent osteoarthritis, but many other health diseases. And see, we urge you all to start, if you haven't yet, start your exercise journey to prevent all of these other complications. If you want to live long and healthy and still be able to climb stairs, pick up your groceries, play with your grandchildren, this is where we start lots and lots of exercises. And see, this is the reference list. If you have any questions, please, if you do see me around, ask me. Or if you can leave it in the chat box as well. If anyone also has a prayer request regarding any health issue, please do reach out as well. We hope that you are all blessed from this study. And thank you so much, and we will see you soon.